Hi, Ashley. How are you doing today?
I'm good. How are you?
Doing well, thank you. So I'm glad that you're able to come in today and be able to get your teeth cleaned, and be able to come and see the doctor as well. What is it that you are here for? What brings you in today?
Well, I haven't been to see a dentist for 10 years, but I love coming to support the schools and get my teeth cleaned by the students here at the hygiene schools. I've been noticing a lot of staining on my teeth and it really bothers me. And in the back here, on the left side, I have this like gold crown and it just seems to be like discoloring. It's not as shiny as it used to be. So I'm wondering if that needs to be replaced.
Okay, yeah, those are really good. Those are some things that we're gonna look at today, and we will, I guess we will go over those as well. So today we're gonna be taking a full FMX. We're going to probe your teeth, and then we will clean them, and then we're gonna go over like some things that you do with your cleaning, as well as how to take better care of them, okay?
Okay.
Awesome. Okay, so what we're gonna do now is we're gonna kind of go through your medical history. Is there anything that needs to be updated or that you would like to inform us about?
I'm not sure if it's in your charts, but I did have breast cancer about 3 years ago. I had a mastectomy, and I am currently taking hormones for those.
Okay.
I had chemo for 4 months, and I did radiation for 2 or 6 weeks, and I'm now in remission. So
Awesome. Well, that's so good.
yeah, I do get some stomach problems too. I get some ulcers and hernias and stuff, but I've been able to get rid of that. So
Okay.
but that's been a while ago.
Okay. Awesome. And then, is there anything in your family's health history that we should be aware of as well?
Yeah, we have some cardiovascular disease on both my mother's and father's side.
Okay.
And are you still on the same medication, the Femara?
Yes, I'm still taking that.
Okay. Are you doing any over-the-counter medications?
You know, I take some aspirin for blood thinners. My doctors recommend I take a daily aspirin.
Okay. And still no allergies that you know of?
No.
Okay.
Wonderful. Awesome. All right. Well, we'll go ahead with that treatment then.
Okay.
Thank you. Okay, Ashley, so what we did, so we just went over and did an extraoral and intraoral exam like we expressed to you. So what we found was that everything was all within normal limits, but as we were palpating your left submandibular nodes, they were very like palpable. And so that is kind of an area that we want to keep a look at and like review. So we want you to come back in about 2 weeks, so we can like reassess that and then perhaps send you off to a referral. Is that okay? And we also want you to be aware of that area and making sure that it's not getting larger, and if it is, letting us know as well.
Yeah, especially since you have a history of cancer. We're not trying to scare you. We're just trying to make sure that we take care of you and let you know everything that we see today.
Okay, I appreciate that.
Okay, so we just finished doing your assessments, Ashley, and you actually only had an 8% bleeding index, which that's actually considered low. But are you a former smoker? Do you smoke?
I do. I actually smoke quite a bit. I smoke a pack a day. I've considered quitting, and I just can't find the motivation.
Okay. So that we do take that into consideration. When you smoke, it constricts your blood vessels, so you actually don't get too much bleeding in your mouth. But your probing depths, we actually want it to be 1 to 3 millimeters, and you have areas around your whole mouth that are 5s, 4s, and 6s. So I can show you that right here.
All of the red is just where areas of concern. So it's kind of all over your mouth. You do have some areas that are deeper
right at the bottom anterior teeth. And I just want to show you your x-rays.
Normally, we would want the bone level to be a little bit higher than what it is. So we would consider that severe periodontitis, because we don't have a lot of the
bone covering the root surfaces. We do have some work to do. I did take some pictures of your mouth that will show the dentist, and he can go over what we could do about your bridge.
Okay.
Okay.
Yeah,
Alright,
that
what
looks like
else?
it's discoloring.
Yeah, that's fair. But we can ask the doctor what his opinion would be on how to go forward with that bridge of a crown. Just because there is a lot of bone reduction, we would want to see if a bridge would be beneficial to that area in the mouth. Does that make sense?
That does. Yep.
Wonderful.
Sounds great. Let's get started.
Sweet, awesome. Well, we will bring in the doctor and we will get going on that. But before we do that, we just kind of wanted to go over how to, because we saw on your form that you said you brush with a hard bristle, but you brush every day,
And I
like
want to make sure you get it really nice and clean.
Very true, yes. And that you do have some problems like flossing that bridge area because it shreds that floss.
Mm-hmm.
Yeah, that makes sense. Well, that's really good that you're brushing and flossing. I think that's really good. We want to keep that up. Some things that I would take into consideration and like perhaps might be helpful would be to use an electric toothbrush because that really helps minimize the wear and like the just like how hard we're brushing on our teeth. Because you said you were using a hard bristled brush, and that can cause a lot of like bone reduction as well, as we saw in those x-rays. So we want you to try that out perhaps.
Okay.
And then you said that you're not using a fluoride toothpaste, but we think that that would be a good idea to do because then that helps the teeth become stronger and be able to remineralize a little bit more. Is that okay with you?
Yeah, I think I could switch to that.
Yeah, is there any like hesitation or like, I don't know, reservations that you would?
No, is there any, anything bad about fluoride?
No, we just don't want you like probably eating it, but I wouldn't say that there's anything bad with it. In fact, it's very, very helpful. Do you drink the water in the tap water, or do you drink the bottled water?
I drink bottled water.
Okay, yeah, I think it would be a good idea to use that fluoride toothpaste because then that adds a little bit more fluoride into your daily routine, whereas you're not drinking the tap water, which has it in there already. Okay?
Okay.
Sweet. And then as you're brushing with your electric toothbrush, we just want you to make sure that you're not pressing really hard with it because then the bristles like bend just like so. I want you to be very soft so that the bristles stand up straight and that you're going in a nice like circular motion, just like this. And we want you to do that for more than 2 minutes, making sure that you're angling it very nicely and making sure that you're getting all areas, but also making sure that it's soft again, okay?
Okay.
Sweet. And then another thing that I would recommend, perhaps, I know that you're getting your the floss shredded through that bridge. Perhaps trying a water flosser would be a good idea because then you don't have to put anything under it and it will help irrigate it through it. Does that sound okay?
Yeah, is there any type of technique that I could use with the flossing?
Yeah, for sure. Yeah, if you want to, there's also an option called Super Floss. So what Super Floss is it has like a little pointy end, because you know how when you put it under the bridge, you use that to the blue little flosser? Yes. So what you could actually do is use this one. It's got very nice and it's very like strong, so you can just poke it through and you don't have to floss it. And then this portion has a nice fuzzy area that then causes it to like help get all the food out of it.
Oh,
And it's a little bit stronger.
They're
on
just
here.
always coming out with something new, aren't
I
they?
know, they are, so it's really good. And then we saw in your form that you wanted help understanding how to floss a little bit better. So what we want you to do is we want you to just floss just like normal, okay? But we want you to wrap the floss around the tooth like a C-shaped motion and then pull up, just like so. And you can pull that down and go up and down multiple times, or around 2 to 3 times. Does that make sense?
Yes.
Wonderful. All right.
Yes, I'm gonna have to try that.
Yeah, we're actually gonna have you try that right now.
Okay. So I take it and I wrap it around like this
Yes.
and scrub, right?
Yes. Scrub up
Okay.
and down. Perfect.
Oh goodness. Oh, there it goes.
Yeah,
okay. And then try it on the other side.
Yes.
Perfect. I think I can do that.
Wonderful. Awesome. And so will you do that and try that in your daily home routine from now on?
I sure can.
Awesome. And is it okay if the next time you come in that we follow up with you and see how this is going?
Yes, I would love that.
Awesome, wonderful. Thank you so much. So now that we went over with Ashley about everything, she's now gone home and we're now going to kind of go over her DHDX statement and like what we have found. So the DHDX statement that we have decided was going to be generalized plaque-induced moderate periodontitis with localized severe periodontitis. And the reason we have decided this is because after reviewing her perio probes with all these 6s, even in the anterior quadrants, as well as these posterior quadrants, both on the upper and lower, we can see that there is quite a bit of bone loss and areas on her gums. And then we're gonna go over to her images. So with those images,
We listed her as periodontitis because of how much bone loss she has in the molars. It's like almost like 3 to 4 millimeters below the CJ, but in the lower anteriors, it is severe. So it's localized severe bone loss in her lower anteriors.
yes.
Yep. You can kind of see it over here too. She's got bone loss up here.
Yeah, bone loss quite a few areas. So that's why we are also going to be doing
The generalized moderate
yes,
periodontitis.
exactly.